Hello and welcome to another response video workshop. My name's Jamie.
And I'm Heather.
And today we're going to be looking at Achilles tendinopathy. So we're going to be running through the anatomy, the physiology, different symptoms that you may be experiencing, and then different ways that you can help to manage and maintain this injury. So the Achilles is the largest and strongest tendon in the body. It attaches your calf muscles, which are your gastrocnemius, and your soleus, which runs underneath, all the way down in towards your heel.
The job of the Achilles tendon is to act as a spring, so it stores energy and then releases it in activities like walking and jumping. Anatomically, it plans to flex as our foot, which means pointing our foot downwards, or if we're stood, it's when we go up onto our toes.
So when we're thinking about Achilles tendinopathy, generally we can classify it into two different locations of pain. One is a mid-portion Achilles tendinopathy, which will be within this sort of area of the tendon. This is a few centimetres above where it inserts into the heel bone. The other one is an insertional Achilles tendinopathy, and this is where you get pain directly onto the heel where it inserts.
So the symptoms we'd experience with Achilles pain, like Jamie said, would be in that mid-portion area, and we'd feel it if we've done too much activity, so we'd feel it later on past what we've done. The 24-hour pattern of pain is important because tendons tend to warm up, so they might actually feel okay during your activity. It's later on that we'd feel the pain. Because of this, we might also feel quite stiff in the morning, so we'd feel stiff, start to warm up, and again feels a bit better later on into the day. We might also notice some swelling around the area. We might have a more thickened tissue around that Achilles. That might be more permanent, but it just tells us that more load has been placed into that Achilles tendon. So the causes of Achilles pain can be multifactorial, which means there's lots of reasons it could start. We could have spiked our load, which means we've just done more activity than the tendon's got capacity to manage.
We may also be slightly more sedentary with our day jobs and not be moving very much during the day. If that's the case, our muscles get very, very tight and the calf complex can start to pull on the Achilles, which just inserts into the heel. That's when you might get a little bit of irritation and tightness and pain around that area.
Sometimes some medical problems can cause us some Achilles pain, so if the exercises we give you today don't help, or you notice that you've got Achilles pain in both sides, it's probably worth getting checked by a medical professional.
Another reason why we might get Achilles tendinopathy is because of increased weight of our body. If we have an increased body mass, it means that you're getting a lot more pressure going through those tissues, tendons and joints, and that can tend to flare things up around your Achilles, especially because there are weight-bearing sort of joints and structures.
Sometimes the footwear we choose can affect our Achilles pain. So if we're spending a lot of time in a heel, we're shortening the calf muscles, which means we go back to a flat foot and it's difficult for the Achilles to lengthen. So looking at footwear can be helpful.
So I thought it'd be good to show Heather's Achilles in this video, just so we can get a visual representation about what's been going on. So as I said before, when we're looking at the Achilles, it attaches from your calf here and all the way down into your heel there. So people with mid-portion Achilles tendinopathy might be getting pain all the way along the tendon here, a centimetre or a couple of centimetres above the calcaneus, this heel bone here. So basically when we're looking at this in the clinic, we're going to be running our sort of hands all the way down this Achilles and seeing if there's any pain present when we're putting a little bit of pressure on. I must add that there are quite a few different structures involving different muscles, tendons, ligaments and nerves and bursa, which could be contributing to this pain. So if you are struggling to work out what's going on, come in to see us at Response and we'll give you a better understanding about really the true cause of this pain.
So the first thing we can do for some self-pain management and to make it a little bit easier is some self-release on the calf. So Jamie's going to demonstrate this with a massage ball. He's going to sit with his leg extended. So Jamie's going to place the ball underneath his calf muscle and put a little bit of pressure into his calf muscles. It should feel a little bit tender, but it will start to relax after a couple of minutes. If he wants a bit more intensity, he's going to point his toes up and down, feeling a little bit more pressure into the calf, and he's also going to roll his leg forwards and backwards over the ball to try and get a little bit more release through there.
So when we have Achilles tendinopathy, our calf complex and the muscles that surround it can get quite tight. So what we generally want to do, along with building its strength, releasing those muscles off a little bit, is to try and stretch the muscle as a whole. As I said before, the calf complex is made up of two different muscles. We have our gastroc muscle, which inserts over your knee and is generally stretched when your knee is straight, like Heather's doing here. So she's going to face both of her feet towards the wall, bend her right knee and lean forward into that stretch. Then when we want to stretch the soleus muscle, all she's going to do is gently bend this knee a little bit and leaning even further forward. And then she'll feel a little bit more of a stretch in the muscle underneath the gastroc, that's your soleus. We generally want to hold these positions for about 20-30 seconds and repeat fairly regularly throughout the day.
So the first exercise we're going to do to look at Jamie's strength is a calf raise. Early days it might be really quite sore, quite irritable, so we can do this just holding the muscle position. Jamie's going to demonstrate, so we need a pillow and he's going to come up to the wall. We're thinking that we're going into a typical calf raise, but we're just going to hold it. So as you can see, Jamie's pushing up onto his toes. You can see that his calf muscle's working, and he's going to hold that for about 20 to 45 seconds, as much as he can manage without his pain coming on. He's going to rest, come off, and then repeat that little exercise 3 to 5 times over the day.
So the exercise we just looked at was called an isometric contraction, where we're pushing against a pressure and not moving our joints. So the next way to progress your strength throughout your calf is going throughout the range of motion whilst we're building strength. So the first way we can do this is a double leg calf raise, where we're on both feet, pushing down through our toes to bring our heels off the floor. You'll feel a contraction into your calf muscles whilst we're keeping the knees straight. The next way we can progress is by going up on 2 feet, switching all of our weight over to the affected side, and then slowly lowering ourselves down on that single leg. That's going to build the resilience and the capacity of that muscle. Once that again becomes more comfortable, we can go all the way up and all the way down on just a single leg. This is going to start to replicate and stimulate walking and running, for example.
So the next progression onwards, Jamie's going to do that same set of exercises but off a step, so that he can stretch through his Achilles whilst he's doing the movement. So we call this eccentric loading. It's a different type of loading for the Achilles that we need if we are going to be running and jumping. So he's going to start exactly the same, 2 legs to share the load. He's going to go up high onto his toes, and then he's going to lower back down, letting his heels drop off the back. So he'll feel a stretch in the Achilles, and then he'll repeat that up and down. And he's focusing on slow and controlled rather than bouncing and relying on momentum. And he's looking at the quality and the position of his calf raise. So he's trying to avoid his heels kicking too far in or too far out. Just means we're not targeting the Achilles. And he's trying to keep his knee straight if he can. So if he notices that his knee starts to bend and buckle, it's probably time to rest and it's just overloaded too much. He's then going to shift onto the rise up on 2. Rest onto 1, and then lower back down on that single leg. Once he can do this without pain, we're going to do it purely on 1 leg. So he's going to balance on his leg to start with, up high onto the toes, still slow and controlled, and then lowering back down, feeling the stretch into the back, and then up high again. As our Achilles pain starts to settle, we can include some more sport-specific variations of calf raises, especially if we're in running activities. So Jamie's going to set himself up, single leg again, but he's going to put his body onto an incline, so he's now on a bit of a slant. And this just mimics the running activity a bit more. He's still going to rise up onto his toes and push back down, and focus on doing it in this position instead. Again, if we want to make it a bit more sport specific and more explosive, you can turn this to mimic a sled push, so like we do at the gym when we're sprinting with a weight. And he's going to alternate between legs, making it a little bit more explosive but not quite a jump yet. So to make this a bit more sport specific, as Jamie's Achilles pain starts to settle down, he can turn this into an incline calf raise, and this just mimics running a bit more accurately. So he's going to set himself up on a slant, so his whole body is almost like in a plank position. He's going to come onto 1 foot, and he's going to do a single leg calf raise in this position. He's going to feel a slightly different challenge to his leg, and he's going to focus on slow and controlled again. To progress this further, we can introduce a little bit more explosive work, and he's going to use both legs, almost like he's doing a sled push like we do at the gym, and he's going to alternate between 2 legs, not quite jumping yet, but having a little bit of explosive movement in that exercise.
So once all of these progressions become more comfortable, the next thing we can do is add load. So at home, if you haven't got any weights available, you can fill up a backpack. All right, you can put books in or cans of beans or anything like that, just to add a few more kilograms of weight to your body, so that you're able to again go up and down on your toes on 2 legs. Off the step, feeling a bit of a stretch in the bottom there. Then we can go all the way up on 2, shift the weight over onto one side, then all the way down again. Again, slow and controlled, and then all the way up and down on the 1. So it's just a nice easy way to progress and add a little bit more load so we can develop the strength a bit further.
So our next progression is some plyometric work, which is basically jumping. As we mentioned before, our Achilles stores energy and releases it, and that's what we want to try and train now that our pain's feeling a bit better. So Jamie's going to start off simple. On 2 legs, he's just going to jump up and down, try and make his landing nice and light, keep his knees soft, making sure that he's got no pain. So he can progress this on to jumping from one leg to the other. This really mimics our running patterns, and it helps to use our single leg strength. He can move this on again to some single hops. So he's going to be hopping on that single leg to start within one spot, and then to really challenge it, he's going to start to move in different directions, forwards and back, and then side to side. And if we really want to progress this, if we've got gym facilities, we're going to get him to jump up onto steps, up onto boxes, so that we can really challenge the height that he has to do.
So along with stretches, strengthening and self-release of that muscle, we also want to take the whole body into consideration, as other areas and structures might be a little bit weaker or a little bit more tired or tight. So next thing we're going to do is a bit of a mobility routine and core activation based exercise, where Heather is going to go into a typical sort of downward dog in yoga. This is going to stretch the whole posterior aspect of the leg, including the calves, the hamstrings and the glutes, as well as throughout the thoracic and lumbar spine there. She's next going to move in towards a plank position, where she's going to activate her tummy muscles, and it's also going to be stretching out through the calf and providing a little bit of stability through her arms and legs there. So in today's video seminar, we've looked at Achilles tendinopathy. We've looked at the different structures and anatomy involved, the signs and symptoms that you may be experiencing, and a few different self-help techniques to help strengthen, stretch and release those muscles off.
As we've already mentioned, there's quite a lot of other structures around the back of the Achilles. We're looking at the mid-portion Achilles rehab, but we might have some insertional Achilles pain. Sometimes the sheath around the Achilles can get irritated, and these conditions are managed a little bit differently. So if these exercises aren't helpful, that's when it's worth getting your physiotherapist or your doctor involved, so that it can give you a definite diagnosis and maybe just tweak your rehab plan a little bit.
We hope you have a lovely Christmas, and if you've liked our video, please go onto our YouTube channel, like and subscribe to our Facebook, Instagram and YouTube so that you can see further videos in the future. Thanks, bye for now.
Bye.